Hi dentist, it's P square. Routes of drug administration is an important topic as a high yielding 10 mark or a 5 mark question comes from this in BDS Pharmacology second year final exam. Question comes as enumerate routes of drug administration, give advantages and disadvantages of parenteral and oral route. Divided into two types as local acting or systemic route. Starting with local acting, used only for localized lesions at accessible sites, and their systemic absorption from site is minimum, slow or absent. Therefore, systemic side effects or toxicity is minimum or absent, and higher concentration is attained at desired site. It is of three types as topical, deeper tissue and arterial supply. In topical, drug is applied externally to the surface for local action. Advantage: localized action, more convenient, effective mode of drug delivery to skin, oropharynx, eyes, ear canal, anal canal, vagina, etc. Example: cream, gels, ointments. In dental practice as antiseptic, astringents, hemostatic, applied as paints, toothpaste, mouthwashes and gargles. Deep tissue, approached by using syringe and needle, slow systemic absorption. Example: intrathecal injection of lignocaine, which is local anesthetic. Intra-articular and retrobulbar injection of hydrocortisone, that is short-acting glucocorticoid. Arterial supply as close intra-articular injection used for contrast media in angiography, and anti-cancer drugs infused in femoral or branchial artery to localize effect for limb cancer. Other type of route of drug administration is systemic route. Drug is absorbed into bloodstream and distributed all over the body, including site of action. Oral, it is oldest and commonest mode as it is safe, more convenient, does not need assistance, non-invasive and painless. Cheap because it is not needed to sterilize. Example: solid dosage, tablet, capsule, liquid dosage, syrups, emulsions, mixture. Limitations: slow action, can cause vomiting and nausea, certain drugs not absorbed, some destroyed by gastric juice. Example: penicillin G, insulin, and unpalatable drugs are difficult to administer. Sublingual, tablet containing drug is placed under tongue or crushed in mouth and spread over buccal mucosa, where rapid absorption of lipid soluble drugs occur in minutes. Liver is bypassed. Example is cresolite trinitrate, an anti-anginal drug. Rectal, certain irritant or unpleasant drugs can be put in rectum as suppositories for systemic effect, used in patient having recurrent vomiting. It is inconvenient and embarrassing. Slow, irregular and unpredictable absorption into external hemorrhoidal vein, not an internal one. Example: diazepam. Cutaneous, a short knot comes on transdermal patches. Or cutaneous routes of drug administration, highly lipid soluble drugs applied over skin for slow and prolonged absorption. Liver is bypassed. Transdermal system, device in form of adhesive patches of different shape and size, deliver drug at constant rate in systemic circulation via stratum corneum. Drug is held in reservoir between an occlusive backing film and rate controlling micropore membrane. Adhesive impregnated with priming dose of drug that is provided by another film to be removed. By diffusion, drug is delivered at the skin. This is transdermal patch, micropore membrane. Rate of drug delivery to skin surface is less than slowest rate of absorption from skin. Applied on chest, abdomen, upper arm, lower back, buttock or mastoid region. Example of drug is glyceride trinitrate, nicotine. It lasts for 1 to 7 days and provides smooth plasma concentration. It is more convenient as compared to oral route. Limitation is local irritation and erythema. Inhalation. Inhalation of volatile liquids and gases. Example, general anesthetic. Absorbed in alveoli and have rapid action. During administration, discontinued drug diffuse back and eliminate rapidly. Disadvantage is irritating vapor cause inflammation of respiratory tract and increase secretions. Example is ethylene. Nasal. Mucous membrane of nose can rapidly absorb many drugs. Digestive juices and liver are bypassed. Desmopressin applied as spray or nebulized solution has been used by this route. Last is parenteral. Important question. Explain parenteral route of drug administration. Par means beyond and enteral means intestine. Drug is administered by injection directly into tissue fluid or blood without have to cross intestinal mucosa, therefore fast acting, valuable in emergency. Gastric irritation and vomiting are provoked. Administered even in unconscious, uncooperative and vomiting patient. No interfere with food or digestive juices. Liver is bypassed. Disadvantage, costly as it needs sterilization. Technique is invasive and painful. Need assistance but not in case of subcutaneous. And chances of local injury. Important parenteral routes. Subcutaneous. Drug administered in loose subcutaneous tissue. Rich supply of nerves and less vascular. Advantages, self injection possible as no deep penetration is required. Avoided in shock patients as vasoconstrictions delay absorption. Special forms are dermojet, needle not used, high velocity jet of drug solution projected from a microfine orifices using a gun like implement. It is painless and suited for mass inoculation. Pellet implantation. Drug as solid pellet is introduced with a trocher and cannula. It provides sustained release of drug over weeks and months. Example, DOCA, a mineralocorticoid and testosterone. Biodegradable and non-biodegradable implants. Crystalline drug packed in tube or capsules made of suitable material is implanted under skin. Non-biodegradable ones are needed to be removed later on but not other. Tried for hormones and contraceptives. Example, Norplant. Intramuscular. Drug is injected in large skeletal muscle such as deltoid, triceps, rectus femoris, etc. They are richly supplied with sensory nerve and more vascular, less painful, but self-injection is impractical as deep penetration is required. Avoided in patients on anticoagulants like heparin. Intravenous. Drug is injected as bolus in bloodstream and produce effects immediately. Intima of vein is insensitive and drug get diluted with blood. Even highly irritant drug can be injected, but hazards are thrombophlebitis, injected vein and necrosis of adjoining tissue. Only aqueous solutions can be injected. Advantage: 100% bioavailability. In case response is accurately measurable, and the short acting drugs like sodium nitroprusside in case of hypertension. Titration of drug with the response is possible. Risky route: possibility of air embolism is another risk. Intradermal. Drug is injected into skin, raising a bulb. Example: BCG vaccine. Sensitivity testing. Multiple puncture of epidermis through a drop of drug is done, employed only for selective purpose. Intramuscular is injected at 90 degree to skin, subcutaneous at 45 degree, intravenous at 25 degree and intradermal at 10 to 15 degrees. These are routes of drug administration. And this is picture of systemic route of drug administration. Thanks. Make sure to share the knowledge with your friends. Keep supporting.